Hello, my name is Alexander, and today we're visiting doctor transplantologist who is specialized in kidney transplantation, Dr. MURAT TUNCER. Hello, doctor.
Hello.
And today we will talk about kidney transplantation and some details about this process. But first of all, we want to get acquainted with you. And would you mind to tell about your experience, how long you're working in Medicana, and how did you get to this profession?
I've been working in kidney transplantation more than 20 years, and as a team, we did many interventions in kidney transplantation. For example, in Antalya, as a team, we were the biggest transplant center in Europe, then in the world. Generally, our team does more than 500 kidney transplantations. And I said before, there are many interventions in kidney transplantation, mainly the first pancreas and kidney transplantation in our country, the first ABO incompatible kidney transplantation in our country, the first exchange kidney transplantation in our country, and the kidney transplantation from hepatitis B positive donors in the world, and also kidney transplantation from FMF heterozygote people in the world. And also in 2 years recently we did a 7-way kidney transplantation. It's also the first outside the US, and also usage of ATG with CD3 and CD4, and we got some improvements by these studies. So as a team, we have many patients, many interventions, and I have been working in Medicana for 5 years. And after I began to study in Medicana, the Medicana Istanbul team is also the #1 living-related kidney transplantation team in the world.
Okay, thank you very much. If you don't mind, I would like to ask some questions from start.
Of course.
Actually, which diseases could be treated, and when it's needed, kidney transplantation?
There are 3 main diseases that cause kidney disease. The diabetes mellitus, hypertension, and glomerulonephritis are the main diseases. So, as a whole, the protective measures are very important to decrease the prevalence of chronic kidney disease in our countries. And in kidney transplantation, also these kind of diseases are very important, because kidney transplantation is not only due to immunological process. Due to the developments of immunological drugs, we only see acute rejection rates lower than 10%. Then we have to increase the graft survival of the patients. So we are focusing on the hypertension, diabetes, and also recurrence of the glomerulonephritis. This is not different from the original ones.
Okay. Well, when a patient faced with those diseases, and which procedure he should go through to be prescribed for kidney transplantation? I mean, which analysis, and how do you decide that this patient should be transplanted?
I think going to doctor is very important in that aspect because the kidney transplant, kidney disease is a silent disease. The only symptom is nocturia. Nocturia means going to a toilet in the night time, and it is more than 2. It shows that there is a problem in some functions of the kidney. So we must go the hospitals to see some results. What are the results? What are the experiments that show whether there's a problem in kidney or not? First of all, creatinine is a very important parameter. Serum creatinine in the blood shows roughly there is a problem in your kidneys. If it is high, it shows that there's a decrease in function of your kidneys. And also urine sample is very important. For example, finding and proteinuria is a very important finding for glomerulonephritis. And also uric acid is very important because if the uric acid is high, it can increase creatinine, it can cause kidney stones, and also in long term it can cause cardiovascular diseases. And also complete blood count. For example, if you are tired, you must go to your doctor, and if there is an anemia, the decrease in hemoglobin levels, it can show the chronic renal failure. So catching the patients before the transplantation period is only possible the patient visits. We must go to doctors in every 6 months.
Mm-hmm. Okay, I got it. Actually, when already decided that a patient should be transplanted, it is needed to have a donor. Yeah. So about the donor, who is compatible to recipient?
The philosophy is this: if we put chronic renal failure patients on dialysis, they will live 3 times lower than the kidney transplant patients. So apart from some life attractive phenomena, the transplant patients can eat, can go whatever he wants or like this. Kidney transplantations give a longer life expectancy. So if as a doctors, if we find an opportunity, we want all the patients be transplanted. And the cadaveric kidney transplantation is very important. If you have a good organization in your country, like in Spain, you can solve that problem by cadaveric kidney transplantations. But generally in the world, despite some activities, we cannot increase the cadaveric transplant rate to the appropriate levels. That's why we must use the living kidney transplantation route. So, which donors are not eligible for kidney transplantations? For example, the donors with diabetes mellitus, lower than 60 years of age, are not eligible to give kidneys.
Mm-hmm.
But recent advantages show that the patients higher than 60 years of age and using 1 or 2 antidiabetics can give one of their kidneys. This is the development. And also hypertensive patients. The patients lower than 40 years of age with hypertension cannot give their kidneys. But on the other side, the patients higher than 40 years of age and having no organ failure, I mean proteinuria or like this, can easily give one of their kidneys.
Mm-hmm.
And also the patients with chronic diseases and that doesn't solved cannot give kidneys. But we must study on case. For example, if somebody have, for example, breast cancer treated, and after 5 years she can easily give one of their kidneys.
Mm-hmm.
So we must investigate the people eligibility, but I can say that 90% of that people can give their kidneys to their relatives.
Mm-hmm.
Giving a kidney cause some problems. There are two main studies that are that we see in the literature, and they say that the kidney donors have longer life expectancy than their twins. Yeah.
Very interesting.
Yeah. Why? Because generally people don't go to doctors, you know.
Mm-hmm. Mm-hmm.
But we see the kidney donors in every 6 months or in every year.
Mm-hmm.
So we are protecting the development of some diseases. That's why they live longer
Yeah, very
than their
interesting fact.
relatives. Yeah. So I recommend anybody to give one of their kidneys to their relatives, because that process doesn't give any harm. In old studies, they said that in the future years, the donorship can cause hypertension or proteinuria, but the recent studies showed that this is not different from the population.
Mm-hmm. Mm-hmm.
So there is no contraindication for the donorship. You know, from 1954, million people give one of their kidneys, their relatives, and if there's any problem, World Health Organization or the organizations of the countries don't approve. So please do not hesitate to give one of your kidneys to your relatives.
By the way, the question,
Yeah.
what happens to the second kidney when one is donated?
Yeah. A good question. In 2 months, the second kidney got an hypertrophied. I mean, the longitudinal axis gets longer
Mm-hmm.
and shows a function like the patients have 2 kidneys
Mm-hmm.
in 2 months.
Mm-hmm.
This is an interesting thing, but I think this is marvelous.
Yeah, yeah. But if we're talking about some parameters which should be matched when we speaking about the donation,
Yeah.
it should be blood type
Yeah.
or HL.
HLA.
Yeah, HLA.
Yeah.
Tissue compatibility.
Yeah.
What should be which procedures should be passed to figure out is this donor is appropriate or not?
The most important thing in that aspect is ABO blood compatibility. In past years, HLA tissue type compatibility was important, but we showed that especially in living kidney transplantation. There is no difference between 0 mismatch or 5 mismatch patients.
Mhm.
So HLA type mismatch is not important in living kidney transplantation. That's why we can have kidneys from the wives or husbands.
Mhm.
In old times, we couldn't get the kidneys. By the way, we increased the transplantation rate 20% for 20 years. And the ABO incompatibility is important, as you said. For example, the mother wants to give her kidney to her son, but the son's blood group is 0 and mother's blood group is A.
Mhm.
So the solution is exchange kidney transplantation. We find another couple, and in that couple the donor's blood group is 0 and recipient blood groups is A. So we cross this.
Mhm. Mhm.
We can do this cross, for example, 2-way, 3-way, 4-way. As I said before, we did 7-way.
Yeah.
So by this way, we can solve that problem. So interestingly, for example, in Istanbul, in Medicana, we do many international kidney transplantations. Why? Because we got a pool. We have patients from, Ukraine, Georgia, Russia, Germany, like this.
Mhm.
More than 40 countries. And that patients cannot give their kidneys to your relatives due to blood group incompatibility.
Mhm.
What we are doing is, in that pool, we match the pairs so we can do a kidney transplantations. For example, some patients from Ukraine will be compatible the patients with Egypt.
Mhm.
We cross this.
Uh,
So this is the best way to solve the problem of kidney transplantation internationally, I think.
How many time usually takes to find a matching pair when patient with incompatible donor comes to clinic?
Generally, the patients admit to our clinic. In 3 months, we can solve the problem.
Mhm.
Because occasionally there are other problems, PRA level is important in some patients, especially patients with second transplantations. They have already anticorps in their body, and that anticorps can react with the new donors. So in that cases, we also do a desensitization techniques.
Mhm.
So generally in 14 days, we can give some drugs to desensitize the patients to be eligible for kidney transplantations. In some cases, we do both desensitization and also cross-transplantation.
Mhm. Mhm.
So I can say that 99% of patients can be transplanted with these new developments.
Which procedure or which preparations should be done before operation?
Yep. This is very important, especially for the donors. We do some experiments, more than 40 experiments, and for example, radiologic examinations, blood examinations, urine examinations, physical examinations, like this. And we are trying to find any problem both in donor and recipient. And if you don't find any problem, we approve the kidney transplantation, and it takes generally 3 days. After 3 days, we can do a kidney transplantations. We got an algorithm. By the way of that algorithm, this doesn't take so much long. If you don't have an algorithm, the preparation takes 1 month, 2 months, and in that case, sometimes donors doesn't give their kidneys like this. So algorithm and preparation and time is very important for the patients.
Yeah, I understand. You mentioned that some donors are not given the kidney. What usually prevents them to donate the kidney?
Generally, diabetes. As I said before, the donors have lower than 60 years of age and have diabetes. They can't give their kidneys. And the other one is some problems that are not as expected. For example, sometimes we find donors with only 1 kidney.
Oh,
yeah.
That's good.
They don't know because everything is good. Yeah.
They have only 1 kidney.
Yes, because as I said before, 2 kidney or 1 kidney is not different.
So people don't know.
Yeah, people don't know. And also some vascular problems. But as I said before, these problems aren't higher than 10%. So 90% they can give their kidneys to their relatives.
About the operation itself, how long it takes?
In our center, it takes 1 and 1.5 hour. And operations, will be done not open techniques, with laparoscopic techniques. All
for
operations
or for both?
for donor and also for recipients, because we know that with laparoscopic techniques, the hospitalization dates will be lower, and the pain will be less. So these techniques are more comfortable for the patients. That's why for all patients, donors and recipients, we recommend the laparoscopic techniques.
And there are some cases when actually it's better to do open operation.
Yeah, of course. For example, during the operation, if there is a problem, we pass to open techniques. But these are very low, 5%, I can say.
Before operation, usually patient goes through hemodialysis.
If the patients are on dialysis, 1 day before we have the patients on dialysis. You're right. But if the patients are not on dialysis, I mean the preemptive. Preemptive patients have glomerular filtration rates, the kidney function, lower than 20 milliliter per minute. We don't have that patients on dialysis because they are afraid of dialysis. So we are trying not to take the patients before the transplantation. Generally, we do transplantations and no dialysis. They don't know or they don't see any dialysis machines before the kidney transplantation and after also.
But if they do dialysis, how fast kidney starting to work, and when dialysis could be cancelled?
The dialysis is important. If the patients have on dialysis more than 2 years, it can cause some detrimental effects of the success of kidney transplantation. So we recommend that all patients to be kidney transplantation earlier than 2 years, and also especially before the dialysis. But if you do 1 or 2 sessions before the kidney transplantations, I mean for the preemptive patient, that doesn't give any negative effect of the patients. Why we don't take our patients, our preemptive patients, to dialysis before transplantation? Due to psychological effects, because they don't want to be on dialysis, and we don't want them to see dialysis before the kidney transplantation.
So when operation is done, what procedure follows the operation? The recipient and for the donor, which medications they should take?
Yeah. Of course, there are some painkillers both for donors and recipients, because this is an operation, and hospitalization duration generally takes 2 or 3 days for the donors and 5 to 7 days for the recipients. Donors, for example, for the donors, after discharging, there is no drug. No drug, because they are healthy. For the recipients, we give some drugs. First of all, some immunological drugs, namely, immunosuppressive therapy. Generally, we do a triple therapy. This is the most popular one that consists of corticosteroids and mycophenolic acid preparations and CNIs, namely cyclosporine or tacrolimus. It's called triple therapy. And also, especially for the 6 months, we give some antibiotics, antimycotics, to get rid of the infections. Because in the first 6 months, we have to give immunosuppressive therapy in the high dosages. That's why we have to protect our patients from infections. And in Turkey, especially in Medicana, we give a low dose therapies. By the way of low dose therapies, our complication rates are very low, because these are very important. For example, I have a study, 4,000 people, and they are followed for 10 years. The development of oncological diseases rate is 0.4% in our patients. This is very important because general population is 1.5%. With the new developments of immunosuppressive drugs and low-dose therapies, we can say that transplantations don't increase the rate of oncological diseases.
Okay.
And this is very important.
And those medications should be taken in the whole lifespan, or?
Especially for the 3 ones, immunosuppressive ones. Today's medicine show that any patient must have at least 3 drugs for the whole lifespan. But I think with the developments we can decrease the drugs, especially by the usage of stem cell therapies. But we are waiting for this now.
It's in the development stage?
Yeah, in the development stage. I think in 5 years we give the patients stem cell therapies, and we can decrease the immunosuppressive drugs, and hopefully we don't give any immunosuppressive drugs.
Okay. And how often the patient should visit doctor after transplantation?
Yeah, visiting is very important because the most important parameter that increase the kidney lifespan is going to visits and using the drugs exactly. So in first 3 months we see our patients in every week. Between the post-transplant 3 to 6 months in every 15 days. Between 6 months to 1 year we see patients in every month. Between post-transplant first to second year in every 2 months, and after second year in every 3 months. So this is very important. For example, I have a kidney transplant patient and we did that kidney transplantation 43 years ago. 43 years ago,
Really
yeah.
impressive.
I have many patients having a kidney lifespan of longer than 40 years, 30 years, 20 years. This is normal for living kidney transplantations. And she comes in every 3 months for 43 years. That's why her kidney life is so long.
And by the way, who was the donor? Is the relative or not?
Yeah,
It's relative.
her father. Her father. But I have many patients with cardiac kidney transplantation more than 20 years.
Yeah, that's good to hear.
Yeah.
And maybe the last question, what message do you want to send to your future patients?
Yeah, this is very important aspect. This is a health problem in all over the world because I know in Turkey 14% of patients have chronic kidney disease, and this is not different from US or Europe. So this means that 15% of us will have the chronic kidney disease relatives. So this is very important. For example, I have many friends, I mean the doctors, with chronic renal failure, with kidney transplantation like this. So first of all, we have to give our organs, especially I mean the cardiac kidney transplantations. This is very important to solve the problems in our countries. And also, we have to give our organs to our relatives. Why? We can increase their lifespan. We can protect their deaths. And the last, we must share the organs. Because disease is the disease, human is the human.
Yeah.
This is not different in Turkey, Ukraine, or like this. We must share this. And by the way of this, we can solve that problem.
Thank you very much.
Thank you. Thank you very much.
It was a pleasure to talk to you, and I remind you that with us was Dr. MURAT TUNCER, specialist in kidney transplantation. Stay with us, subscribe to the channel, and leave the comments in below.